What is Noonan syndrome? It is a disorder that causes unusual face characteristics, short stature, developmental delays, malformations of the bone, and rib cage. Noonan syndrome is caused by changes in one of the autosomal dominant genes, meaning a chromosome that is not a sex chromosome. This disorder is inherited in families of autosomal dominant pattern, which means a person that has Noonan syndrome has a copy of an altered gene. Unusual face characteristics, short stature, heart defects at birth, webbed neck, and eye problems such as strabismus are all symptoms of Noonan syndrome. Noonan syndrome can be diagnosed with a blood test for many genetic mutations. But in about 1 out of 5 causes, nothing specific can be found, so a negative blood test won't cut it. This genetic disorder is strongly suspected. More tests will be needed to establish the extent of the symptoms. This may include ECG, when electrodes measure the electrical activity in your heart. Some tests may be repeated regularly after the diagnosis. Noonan syndrome is a lifelong disorder. The life expectancy of a person with a disorder depends on the severity of the heart defect. A graph I made was a pedigree. This pedigree, the shaded ones represent the affected males and females. It starts with an affected male and a wild female. Then it goes on to one affected male, wild female, wild male, and wild female, with an affected female and wild female, and a wild male and affected female. So there are 3 affected males and 4 affected females. As I said before, the symptoms and effects of the disorder are unusual face characteristics, short stature, heart disease or defects, webbed neck, eye problems, bleeding problems, unusual chest shape, developmental delays for males, and descended testes. These are all symptoms and effects of Noonan syndrome. As I said before, a life expectancy for a person with this disorder, it depends on the severity of the heart defects. Treatments are actually made with treatments for this. Well, there are no treatments. You can't get rid of it because you are born with it. Wow. But the treatments for this can do counseling or therapy. Can deal with counseling or therapy. One foundation that supports this disorder is the Noonan Syndrome Foundation. They support, educate, and advocate people who have been affected by this genetic disorder. The foundation is organized by volunteers, which means they do not get paid salary, and all activities they do are covered by grants or donations. this specific disorder is not caused by trisomy 21, but by a faulty gene, which is a dominant gene. Although a lot of people are affected by this disorder, they doesn't mean they can't do normal stuff like normal people.